Hello, my name is Karen Knight. I'm the Medical Education Librarian for the School of Medicine at the Claude Moore Health Sciences Library. Earlier, I provided a video tour of the physical layout of the library building. Now I would like to introduce you to key information sources that will help you find the information to answer your questions. I'd like to give you a preview of what I'm going to cover in this video. First of all, I'm going to take a look at the two most common types of questions that you will have in medical school. Secondly, I'm going to review the strengths of the information sources that can be found on my medical student portal page. Third, I'm going to introduce you to two large ebook collections and also two large multimedia programs. Both of these you will use a lot for your assignments. Fourth, I'm going to introduce you to the 5A framework for answering clinical questions in your Foundations to Clinical Medicine course. Fifth, I'm going to demonstrate a practice search looking for journal articles using Ovid MEDLINE. And lastly, I'm going to demonstrate a search in a product called Essential Evidence Plus to find pre-validated synthesized answers that will help you with those clinical questions. Okay, so let's get started. It's best to start by assessing your information need. As a medical student, your questions are going to fall roughly into two categories, and the resources and techniques that you use to find answers to those questions will differ based upon the category. The most common type of question in the first 18 months of your curriculum will be background questions. You will be learning how to find and access background information quickly from a variety of sources for class readings or to support learning in general. The second type of questions will be clinical or patient-specific questions. In this case, you will be hoping to find what we call best evidence from very patient-specific clinical care and decision-making literature. Let's start with background questions and take a look at resources that will be useful in answering them. Have you ever heard of the old saying that if all you have is a hammer, everything looks like a nail? Well, I don't want that to happen to you. I want you to start medical school with a full toolbox, full of different tools that you can pick from to answer different kinds of questions. In looking for answers to background questions, I think my medical student portal page is a good place to start, as I have assembled links to the products that you will find most useful. You can get to the medical student portal page from the VMed page, your learning management system, and also you can get to it from the library's main website, shown here. You would click on Students, then select the link to Medical Students. I've arranged the medical student portal page into broad categories. So depending on whether you're looking for books, journal articles, clinical practice, drug information, multimedia, or board prep and practice questions, you can see key resources listed under each category. Background questions are informational questions that are either improving your understanding of a topic or perhaps building your knowledge on a topic for the first time. The characteristics that you want to look for in a source to answer a background question is that they have been synthesized and summarized for you for quick and ready access. We have two major ebook collections, and they can both be found in the book category on my medical student portal page. One of these is called Access Medicine, and the other one is called Clinical Key. Between the two of these products, we probably have about 1,500 ebooks that can be accessed 24/7. One thing both products have in common is the ability to create a personal account, and I have highlighted here in red where you would do that in both products. I recommend you do this first thing. Go ahead and set up a personal account in both products. Personal accounts will enable you to bookmark and save items. It will also enable you to print full PDFs of some chapters. So it's definitely worthwhile. Another feature both ebook collections have in common is the ability to browse titles or to search for a specific book title. I'm mentioning this because often your faculty will give you a link to the reading they want you to prepare for, but just in case you can't get to it from the link or the link is not working, you can also search for the specific book or chapter that you're looking for. In addition to searching for specific books, you can also search within books, and that can be very helpful. So here's an example from Access Medicine. The book is Current Medical Diagnosis and Treatment. I can search within it if I'm only looking for the chapter on dermatologic disorders. Even though I've been talking about both of these products within the realm of their books, I want you to know that they also contain more than books. Access Medicine and Clinical Key both have multimedia. Here's an example of some multimedia sources within Access Medicine. So multimedia like images and videos. These products might also have self-assessment tools that you can work through on your own. Here's an example from Access Medicine of a popular product called flashcards. Speaking of multimedia, my portal page also links you in a category called multimedia to two products you will use heavily in your medical curriculum. One is Ackland's Video Atlas of Human Anatomy, and the other one is Bates's Visual Guide to Physical Examination. Here's an example from Ackland's Video Atlas of Human Anatomy on the upper extremity. And this is what Bates's Visual Guide to Physical Examination video series looks like. Here is a particular series of videos on the head-to-toe assessment of the infant. Both of these are wonderful products. Not every question is best answered with a book. So what if this was your question? What is the name of the rash that some lupus patients get? You don't maybe have enough information to even look it up in a book chapter. All you can remember is that it has some kind of an insect name. In that case, our friend Google will come to the rescue, because I could just type in lupus rash and hopefully it would lead me to the right answer. And sure enough, I not only find out that it's known as the butterfly rash or malar erythema, but I get a picture or many pictures of it. It sort of looks like a slapped cheeks on both sides of the person's face. So Google is a great finding tool. What I don't want you to do is to cite Google as your source. Google is a finding tool, not a source. So when I searched for my rash, the information that came back came from several different sources. I ended up using the image and description from the Mayo Clinic. So I would cite Mayo Clinic as my source, not Google. So that leads us to just the importance of evaluating information no matter where you find it, even if it's from a textbook. Be sure you evaluate it. First and foremost, evaluate it for currency. When was it published? I find this is the thing that we are most often not doing. We assume if we find it on the web that it's got to be current. But nowadays, of course, the web's been around for a long time, so that's not true. So what's the date? Secondly, who has sponsored the information or created the information? So who is the author? Do they have a bias, inherent bias, that I need to be aware of? Be aware, of course, of opinion over facts. We're so familiar with this problem now within social media, but you need to be able to evaluate, how do I know if this information is true? And lastly, if it's clinical information we're looking at, are there levels of evidence that are given that indicate how strong the study design was that produced the results? And we'll talk more about this later. So far, we've been discussing information sources that help you answer background questions. Your background questions might be clinically related, but they are first and foremost knowledge or background questions. Earlier, we were asking what sort of information source we should use in order to determine what veins drain from the liver. That's a background question. and using a book chapter or some kind of synthesized summary would be the easiest way to answer that question. If our question turns into a clinical question and instead it's how do I manage a patient in liver failure, then my approach is going to be very different. Clinical questions are often more complex than background questions. They may contain several different concepts. Clinical decision-making should be based upon the best science found in evidence-based information sources. So it's a different technique and different set of sources. Here are some examples of clinical questions. What are the causes of surgical wound infection following hip replacement? What factors influence parents' decisions regarding the refusal to immunize their children? Does the use of cell phones increase the incidence of brain cancer? There is a rubric known as the 5 A's that can guide our process in answering patient-specific questions. This image shows an overview of the 5 A's. 1 is to assess, 2 is to ask, 3 is to acquire, 4 is to appraise, and 5 is to apply. Let's take a closer look at each of these steps. You will get to practice answering clinical questions in a course called Foundations in Clinical Medicine, or FCM. FCM uses this 5A framework, so you will have many opportunities to practice and apply it. The first A is to assess the patient. The clinical evaluation of patients always begins with a thoughtful assessment by the clinician who incorporates the pertinent data from their history and physical examination. For the purpose of FCM, or Foundations in Clinical Medicine, the patient case will come either from a morning presentation in class or from a patient seen perhaps in a hospital visit. After you have assessed the patient, you have determined key issues perhaps from the patient encounter that you need to form a clinical question about to pursue. So that brings us to step 2, and that is to ask the question. Let's look at the components of a good question. There's an acronym that we use called PICO, or PICO, that includes all the important factors that a question should contain. The P is for our patient or our population. I is for the intervention that we're going to be looking at. C is for a comparison or control, and this will not always be in your question. And O will be the outcome. So here's an example of a PICO question. In ventilated patients, that's our population, does the head of the bed elevation of 45 degrees, that's our intervention, compared to 20 degrees, that's our control, reduce the incidence of ventilated associated pneumonia, and that's our outcome. The outcome is a very important part. Don't forget to add that one. We now have the key components to asking a good clinical question: our patient, our intervention, our control, if one, and our outcome. We can also add a couple of T's to our PICO and make it PICOTTT in order to remind us of other key factors to consider when forming your clinical question. For instance, one of the T's could stand for time factors. Do we want the change in our patient to occur within an hour, within a day, within a week? So time factor would indicate when the outcome should occur. Another possible T that you could add to your question is the type of question. So for instance, questions divide themselves into different categories. Is it a therapy question, diagnosis, etiology or causes, harm, prognosis, or prevention? It helps to determine what type of question you have at the outset, because that will determine what type of study you're seeking ultimately to answer your question. Studies, which is the last T that's a possibility, include things like meta-analysis or a randomized controlled trial or a cohort study. Again, knowing the type of question and the type of study helps you determine the best way to answer a question. Here's an example of a PICO or PICO question where we've added a T. In this case, the T is a time factor. So our question was, in surgical patients, that's our population, does chlorhexidine, our intervention, compared to providone iodine, that's our control, reduce surgical site infections, that's our desired outcome, but we've now limited it with a time factor of during hospitalization. So we added a T. Again, PICO is a fine way to form your question. There are just some suggestions of T's to think about when you're forming your question. Is there a time factor? Do you care what type of study perhaps you're looking for? And so that's the only purpose of that acronym. You've met with your patient, you've taken a history, and you've done a physical examination. And you've identified a question that you need answered about the patient. You moved on to step 2 and asked that question in the format of PICO, patient, intervention, comparison, and outcome. And you've added a T for a time factor if that's relevant to your question. Now you're ready to acquire the information needed to answer the question. So we're in the third A of the 5A process. We're going to find our information by doing a MEDLINE search. MEDLINE is a biomedical literature database, so it looks for journal articles in the biomedical literature field, and is created by the National Library of Medicine. As I've mentioned several times, we have 2 versions of MEDLINE. We have the version that the National Library of Medicine themselves offer for free called PubMed, and then we have another version by Ovid MEDLINE. Ovid is a commercial company that purchases the data from the National Library of Medicine and puts their own smart search interface in front of it. I'm going to be emphasizing Ovid MEDLINE for this training because I believe Ovid will help you learn how to search MEDLINE the very best way possible. So in the step 3, acquire, we're going to now take our PICO question and use it to determine a search strategy before we go online so that we can efficiently find the relevant articles to integrate back into our patient management. With your focused PICO question in mind, you begin your literature search. You can search databases such as MEDLINE either through Ovid or PubMed. They are both versions of MEDLINE database for journal literature. Just remember that not all information is created equal. So not every article is going to have a study design that will result in the strongest, most valid results. Evidence exists in hierarchies based upon the strength of the study design and the type of question being asked. As you can see from this pyramid diagram, a meta-analysis or a systematic review is at the top and would be the strongest form of evidence. Evidence hierarchies such as this one can provide a shortcut to help you filter your search to the most likely best evidence for the kind of question that you're asking. A meta-analysis would be great because it would be statistically combining multiple studies. Let's say it was a therapy question. A meta-analysis would combine the results statistically for multiple randomized controlled trials. So that would provide stronger evidence for your topic because it's looking at more than one study. A systematic review is done when a meta-analysis cannot be done. So if the studies are divergent enough that they cannot be combined statistically as one in a meta-analysis, then a systematic review is run across multiple studies and draws conclusions. And then you go down to individual randomized controlled trials, cohort studies, case control studies, case series or case reports, and then just individual reports. Do you remember when we talked about PICO forming your clinical question? I mentioned that you could add 3 T's. One of the T's was for time factors. The second T is for the type of question being asked. It's important to think about what type of question you're asking because the type of study, the third T, is related to the question. So you can see on this pyramid that it's recommending certain types of studies being sought for different types of questions. So RCTs, or randomized controlled trials, are the strongest study design for a therapy or diagnosis question. So again, when you're forming your PICO question, think ahead of time of what's the type of question that you're asking. Is it therapy, diagnosis, etiology, harm, prognosis, or prevention? And then you're going to seek a study that is the best type of study for that type of question. So an RCT or a systematic review or cohort study is what you're looking for. To answer clinical questions, you're going to want to use resources from my portal page that are in the category of journal articles or clinical practice, the two areas that I've shown here in red. So journal articles is a fine place to start by doing, say, a MEDLINE search. And remember, we have two versions of MEDLINE, Ovid's MEDLINE or PubMed, which is just publicly available MEDLINE, same basic database. We have other databases such as Web of Science. So these databases are used to locate journal articles. And within these databases, you can limit your search by publication type. So if you're searching a therapy question and looking for journal articles, you can say, I only want randomized controlled trials, or I only want systematic reviews or meta-analysis. Clinical practice, in that category, we have resources here that have done the journal search for you. They've already done that step, and they have combined the studies that they have found into synthesized evidence summaries. So this can be a wonderful shortcut. And I will show you an example of a search in Essential Evidence Plus. That is probably the one I recommend that you use the most in this category. There's also Up-to-Date. Up-to-Date is really more like a textbook in a sense, but I have it down in clinical practice because it is used the most for answering clinical questions. And lastly, you'll see one mention Cochrane Database of Systematic Reviews. We have a link to the full database, but I would not bother to search it for the most part because Cochrane reviews are included in the hits that you will get in Essential Evidence Plus. So let's take a clinical question and do some sample searches. The question I have is, for an adult male, does a lower sodium diet or lowered reduced salt intake reduce hypertension? This is what this question would look like after I do PICO. My patient is an adult male with hypertension. The intervention I'm looking for is to lower the salt intake or reduced sodium intake. The outcome I'm desiring is a lower blood pressure or reduced hypertension. I don't have a T for time factors in this question, but my second T for the type of question is it's a therapy question. And so the type of study that I would most like to find would be a meta-analysis or a systematic review of randomized controlled trials, or if I can't find either of those, a good current individual randomized controlled trial. I'm going to take you into Ovid MEDLINE and show you how to do a search. This is what Ovid looks like. This is where your search terms are going to accumulate and we do combining and things. And down here is the box where we enter our search term. Most searches include more than one concept. I would like for you to get in the habit of entering each concept individually. The reason why is because research is rarely a straight line. You will often change your mind about terms that you're using and want to recombine them in different ways. So having them available to you individually will enable you to do that. I'm going to, remember my search was about using a low salt diet to prevent or control hypertension. So I'm going to put in my first term, which is low salt diet. And then I just simply say search. MEDLINE is a database that works off of a controlled vocabulary. What I want to do as much as possible is for my terms that I enter to find a match on a controlled vocabulary term. These terms are called MESH terms or medical subject headings. So you can see what Ovid does is it finds the best MESH term. So even though I entered low salt diet, it says, I'm going to say that you should use diet sodium restricted. So in other words, it's telling me that's the term the database uses. If I wanted to bypass that or add to it, I could also select the words I entered here as keywords. Keywords simply means it will look for those words in the titles and in the abstracts. I can do that, but for this particular search, I'm not going to. Instead, I'm just going to say continue. For every medical subject heading, there are subheadings that can be added to them to focus in what aspect of the term we're looking at. So we're looking at diet, in this case, a diet. So it's offering me subheadings such as complications for the diet, economics of the diet, trends. But I don't want any of those in particular. I want all of them. So the default is to include all of them. I don't even have to say include all, just simply hitting continue will leave them all there. This is what the first search step looks like. EXP stands for explode. Diet, sodium restricted is the MESH term I used. And the slash indicates that all the subheadings are still there. Explode is simply a feature that says if the MESH term has related terms, they will be included automatically for you. This is usually a good thing. So we have it turned on to happen for you without your having to do it. My next concept was on hypertension. Now in this case, Ovid found several matches on controlled vocabulary terms, but it's recommending I use the general one for hypertension. And so I'm going to do that. I'm going to just say continue. Now this term has a lot of subheadings. Subheadings, again, are tailored for the medical subject heading, the main heading. So in this case, it's a disease, and the disease probably have the most subheadings available. So because I'm looking at the effect of a particular type of diet or diet therapy, I'm going to select diet therapy. I'm going to select prevention and control, and I'm also going to select general therapy in case the article talked about multiple forms of therapy. Once I select those subheadings, I say continue. And so I see my second term. Again, the EXP for explode. And now after the slash, rather than up here where it's nothing, that means all the subheadings are there, it's showing me the three in particular that I selected. My next step would be to combine them. So I'm looking for journal articles about both of these concepts. So if both concepts have to be there, it would be combined with an and. So what this has been doing over here in my results category is narrowing my results bit by bit. So I'm finding I have under 2,000 articles that would meet the criteria. But of course, 2,000 is too many. So I'm going to go down and I'm going to apply some limits that I had identified. The limits can be found directly below the search box. And so one thing to keep in mind is MEDLINE is very international. If I can't read other languages, I might want to apply the English language limit. I also indicated that my patient population was male, and I'm going to select human in order to avoid the animal studies. And I also mentioned that I wanted adults. So under age groups, I have an adult category. So now I've selected several things. To apply them back to and limit that last search step, I say search. And that gets it down to under 600. So those 600 are about both of these topics and are English language, men, human, and in the adult population. Okay, so that's still too many. There are a couple other limits I could do. One is a publication year. So remember, right now we're searching back into the 1940s. So I could say I only wanted, 2010 up till the present. But I'm going to leave that off for now because some of these studies may have been older studies, but still be good. So another limit I'm going to bring up is the one down here under publication types. Remember, we talked about types of questions and types of studies used to answer those questions. This is a therapy question, and so I would love to have a good randomized controlled trial or a meta-analysis or systematic review. So I can find those limits down here under publication types. Let's look first just for our randomized controlled trials. So the list is arranged alphabetically. I'm going to say I want that, and I'm going to go back up and just hit search to apply that limit to the set up here. So that brought the 571 down to 193. I'm getting closer. I don't want to look through too many, but I'm usually willing to look through 120. This time though, I think what I'm going to do is let me go back to the set that have not yet been limited to RCTs and come down, and this time let's look and see if there's a publication type for systematic review. That would be even better, and there is. So I can apply systematic review and then say search. And that gets it down to 2. 2 is really small. I'd like to have some to choose from, but let's go ahead and take a look at them. To see those 2 records, I can click on display results, or I can just scroll down and they'll be there. Now, these 2 actually look quite good, and they're not brand new. Here's a 2017 and a 2016. But it may be, given that this topic has been researched to death, and those may be the most recent we can find. What I like about them is that they are good overview studies that have accumulated data from many, many trials. Now, when I'm looking through my records, they're being brought back usually with the newest ones first and going back by date. I can click on the abstract if I want to read the abstract as I go, and I can also mark them to do things with them. So if I wanted to email them to myself or print them or export them to a bibliographic management program like Zotero, I can do that. Those are the basic steps to doing a MEDLINE search using Ovid. Here's an example of a question I might take into Essential Evidence Plus to answer. Should my 76-year-old male patient be referred for hospitalization for suspected pneumonia instead of staying at home and being cared for by his daughter? He presents to my office with a slight temperature, decreased breath sounds, and elevated respiration rate. I still don't have his blood work results back. Hello, I'm going to show you how to do a search in a product called Essential Evidence Plus. You can find it on my medical student portal page under clinical resources. Essential Evidence Plus is different from MEDLINE because what if it's kind of like microwave food versus cooking a full meal from scratch. When you're doing a MEDLINE search, you're cooking the full meal from scratch. You're creating a search strategy, you're running your search, you're finding, let's say, 20 to 70 hits. You're having to go through those hits and pick which ones are the best at answering your question. Then you would have to read them, and then you would have to do critical appraisal, which is to run some kind of validity screen across the article to make sure that it was done properly and that the results are valid. That's a lot of work, but it may be what you need to do for preparing for a journal club or if you're writing a paper. But there's also a shortcut, sort of the microwave meal version, and that is going into a product like Essential Evidence Plus, where the literature search has already been done. The results are brought back, and they're usually results from the top tier on that evidence pyramid, and they have been summarized into evidence summaries for you so that they're quick to reference and quick to use. So this is what I'm going to show you an example. I want to refer back to that patient that suspected case of pneumonia, a patient I had seen in my office, and whether I should hospitalize him or not. He doesn't want to go to the hospital, but it may be a relief to his daughter if he is hospitalized, if that's what the evidence shows would be best for him. This product, as you see, searches against several different categories of information. And remember I mentioned earlier that Cochrane database of systematic reviews was one of the products in here that gets searched, and sure enough, there it is. Poems are individual articles that have been appraised for you by experts and given a level of evidence rating. So again, it's not only like microwave food, but they also give you the calorie count, or in this case, the nutrition count. How well done was the study? So this is a wonderful tool in a way to use in order to learn how to do critical appraisal by reading and seeing how other people have done it for you. One thing I will say is it needs a very simple search. Doesn't do well with complicated Boolean operators. So I'm just going to do pneumonia, which is the main concept I was searching. So here I am in my search results. First of all, I could further refine it by type of study. Remember, we talked about type of question is an epidemiology or a diagnosis question. But also I can sort it by the resource that it came from. So is it from Cochrane? There's 232 from Cochrane. Or is it a diagnostic calculator? And I'm going to show you an example of one of those. But what I go for is right here, this first little gem at the top of the list, essential evidence topics or evidence summaries. I find these so quick and easy to use. My patient has a case of community-acquired pneumonia, possibly. It's not a nosocomial or hospital-acquired. So I'm going to click to go into that. So I'm going to show you around an evidence summary in EE+, is what we call essential evidence. At the very top, it gives me a bottom line. I love it when the bottom line is at the top. That just makes life so much easier. So they're saying these are the things you need to look at first. And they link me to pre-validated clinical prediction rules or diagnostic calculators right here. I can also find those right up here that pertain to my case. They give me tables, which is a very quick way to look and see the information. So in this case, it's about antibiotic choice. And then down here, they have tabs for the major things I would want to look up, including the resources. So I've got my resource list. So you can see it's presented in a way that is very quick and easy to use. I can jump around in it. So I want to I want to see whether my patient should be hospitalized. Well, right here, determine the prognosis using a validated clinical prediction rule, such as the Pneumonia Severity Index, the PSI, or the CURB 65 Index. These are two both very well-known pneumonia scoring systems. Now, the B and the C, if I click and hold my mouse over that, it tells me about what the level of evidence is. So sort is a type of criteria. It's just known as the sort criteria. So A is the highest, best, down to D, which is really just expert opinion. So I would like to find information that's in the A and B category as much as possible. This is a B, and they're telling me it's because it's somewhat inconsistent or limited quality, patient-oriented evidence. Now, this product specializes in patient-oriented evidence. And what makes it patient-oriented is that it covers things like morbidity, so the living with the burden of disease. It looks at mortality issues, and it looks at quality of life issues. That's really what patients care about. We don't care that if we take this antibiotic, it makes the flora in our middle ear go away. That would be an intermediate medical outcome. That's not a patient outcome. The patient cares about whether their fever goes down, whether they can go back to work. Those are patient-oriented quality of life outcomes. So that's another wrinkle to think about when you're doing patient care. So let me just take a look at the PSI So here's information about it. But if I want to go to the actual calculator, I can come up here to the calculator list, open that up, and I see it again right here. So I'm going to click on it. I'm going to open it in a new tab just so you can see it better. Okay, and this is what it looks like. I put in the information I know. So my patient is, I believe I said was 76. He's not in a nursing home. He is male. Right now he doesn't have any of these comorbidities. I know his respiration rate is above normal and his pulse is above normal and he has a slight temperature. So I'm going to select those. I'm still waiting on his lab work, so I don't have that, but I can go ahead and say calculate. So what I'm doing is calculating his risk. And oh my gosh, look down here. He comes up as a risk 5 and he has a 19% mortality risk. And it's telling me that a risk 4 and 5 should be hospitalized. So this is not to say that this is cookbook medicine or I should do this or I have to do this. If I'm totally confident that his daughter can take care of him well at home and that she would know to rush him in if anything changed, then that may be a decision we make together, because ultimately you would like to make your decisions with the patient. But but based on this would give me a strong argument to talk to the daughter and to the patient about his risk and about why I'm thinking he might be better off in a hospital. So this is what Essential Evidence Plus looks like. I just want to go back and show you a poem. The daily poems are something you can sign up for. They come every day. These are journal articles, individual journal articles that have been pre-validated for you. So let's take a look at one. You see the pre-validation, that's LOE is a level of evidence. So perhaps this one. Well, how about, well, I think we'll go into this one down here with kind of interesting. The first one I was interested in, this MA, intra-articular corticosteroids provide short-term relief in patients with adhesive capsulitis. So if I click to go into it, right here it gives me the reference of the journal article. So this is a good way to find journal articles if you want to be doing some kind of review on a journal article, because they've already done it for you. You can kind of practice your skills. So they turned it into a clinical question. The title of the article was The Efficacy of Pharmacological Therapies for Adhesive Capsulitis of the Shoulder, a Systematic Review and Network Meta-Analysis. Ah, right there, we like those words because that means that it's looking at lots of studies. They turned it into a question, not quite a PICO question, but what treatments for patients with adhesive capsulitis are effective? That's what patients would want to know. And then they give you a bottom line answer. In this networked meta-analysis, steroid injections provide short-term clinically important improvements in pain, but no long-term benefits. And then they say it's a level of evidence 1A. If I click to look at that, here's what the levels of evidence mean. So a 1A means it was a systematic review with homogeneity of randomized controlled trials. So see how the numbers are 1 is the highest, just like the grading system that we looked at earlier. A was the highest. 5 is expert opinion. So there's been no actual critical appraisal done. So, and then what they do is they tell you what the study design was, the funding source, and they write a synopsis of the article. So, and then I could go to link to it to go into PubMed or to open it in our Find It UVA option. So again, the journal was in the American Journal of Sports Medicine, 2019, volume 47, issue 14. And these are the pages. So that's what a daily poem looks like, a poem, and they accumulate them and put them together for you by month, so you can go back and look at them. Or when you search, it is pulling from poems as well as pulling from Cochrane and pulling from their evidence summaries. So all around, it's a good tool. I like it a lot. It's not perfect. None of our tools are perfect. Just like UpToDate is a great tool as well, but we are worried about everybody using UpToDate. If you are rounding with your team on the floor at the hospital and everyone has only looked at UpToDate, then you could be guilty of groupthink, or somebody could have missed something that maybe has come out in some other format and has not yet been updated in the UpToDate product. So Essential Evidence Plus gives you another product to use. Just remember to do a fairly simple search, or you could put in multiple terms if you needed to. This slide is meant to just show you that, again, we're on step 3, the acquire, and it's just showing you that you can pick from synthesized and graded resources such as EE Plus that I just showed you, or UpToDate, or you can look for individual journal articles from a MEDLINE search. So where you acquire them sort of determines then the next step, which is the appraise, step 4, appraise the evidence. And this is where, if you have picked them from a MEDLINE search, you might need to get some extra literature from critical appraisal guides on how to do it. If you've picked your hits from a synthesized source that's already been graded with levels of evidence, then you wouldn't need to do that. You could just go ahead and apply it. I have prepared a LibGuide that you may want to check out. It can be found on my medical student portal page on the left side under category SOM subject guides. And it's called FCM. Remember, that's your Foundations in Clinical Medicine course using the 5A framework. And it goes over all the different sections and steps that we've been doing. And it does include 2 examples of the level of critical appraisal that you'll need to do for this course. They do not expect you to know critical appraisal at this point in time because you haven't had any training in it, but it will give you some basic checklists. And here is that step 4, the checklist that I've provided for you, just kind of an overview of what to look for to appraise an article. And also, if you Google checklist critical appraisal, you're going to find a ton of checklists that are available for you to use, or sort of guides on how to do it. So there's a lot of literature out there. This is one of the guides that will tell you how to do critical appraisal. It's the Center for Evidence-Based Medicine. It's a UK group, and they actually even have links to critical appraisal worksheets depending on what kind of article you're appraising, whether it's a therapy or a diagnosis or a systematic review. So again, there's a lot of information available to you on how to do critical appraisal. Thank you for sticking with me through this presentation. I hope it will be helpful to you. One thing I want you to leave remembering is that information, unlike bread, doesn't have a sell-by date. Bread is very good at showing us when it's no longer fresh or is something we should be eating. And information really needs that same kind of cue because information doesn't stay good forever. You need to get in the habit of using a variety of information sources with a variety of search techniques in order to be sure that you're looking at the most recent information that's available to you. If that's your goal, you will do fine. You need to always be willing to let go of what you once knew and accept what may be the newest information available now. Good luck, and please remember to ask me for questions. Karen Knight, K-Knight @virginia.edu. Love hearing from you. Thank you so much.